उन्होंने एक साड़ी बनाया जो चेन्नई एयरपोर्ट में है, and it is one of the best sarees that he has woven.
It is a 40 feet length
40
and
feet length.
12 feet height. We weaved each saree and then we stick it into together, and it is placed as a single saree. Each portion, each column exhibit the Tamil Nadu cultural dance like Tappatam, Mailatam, Oilatam. There is some focal dances in Tamil Nadu.
Wow.
We will, from painting, we took it into a design. From design, we take it into a saree. So for single saree, it would took us for 20 days. We completed in 3 months.
I think once we are all in the Chennai airport, we must look for the saree. I remember the saree.
It has been launched by our Prime Minister Modi ji.
So what are the diseases which are spread, which are found? Do you find diabetes?
Not diabetes. Diabetes is become out of 10, some people has a diabetes.
7
nowadays.
people.
Yeah.
So diabetes is very common. Out of 10, almost 7 people are diabetic. Dr. Nishapriya, I'm very happy that I'm with you today.
Sir.
And I have heard so much about you. You had been the chairman of the IMA Women's Wing. We are doing this as an awareness program. Dr. Nishapriya, I'd like to ask you that you have got so many trophies, and what is your impression about women's health in rural areas? Why I'm asking this? Because I'm a protagonist for the women's health.
Okay.
I was in the Ministry of Health, Government of India, because the women's health is very often
Yes.
dismissed.
Yes.
The male gender dismisses it sometimes. They are difficult and they are different and often dismissed.
Yes.
You agree with that?
Yes.
We do not give
Absolutely.
enough care. We do not give.
Yes.
And you know, when the menopause comes, the diabetic women lose their protection against heart disease.
Yes.
And diabetes in women, as Usha Shiram says, is very different. Very different. I would like to know that what is the awareness of diseases in the rural Kanchipuram?
Okay. So, rural women, or frankly speaking, they are not even aware of their health, sir. And they don't reach the hospital in the right time.
They have no access to care.
Yes, yes. Access in the sense they themselves don't go to hospital because they are not concerned about their own health. At the right time, they don't get treated. Family health, yes.
Children health.
Yes. Only in the later part, when the disease is advanced, they come to hospital, and that is the main concern in the rural population.
Yeah.
Compared to the
what is your message? Because we're going to broadcast it to the country. What message you will give for improving the women's health in the villages?
Okay. So, like we care for this tuberculosis patient and all. We have to take, the counts of the rural women, and they need that door-to-door treatment.
Exactly.
Right?
Like Prime Minister has proposed that end TB program.
Yes, yes.
2030.
Yes.
Now made at 2025 must end TB.
Tuberculosis.
Exactly.
Yes.
I think that's very correct.
Yes.
We must do door-to-door survey.
Yes.
Somebody even proposed that, like we have directly observed anti-TB therapy, we can also give anti-diabetic drugs directly observed.
Yes.
Do not take. The compliance is low.
Okay.
Very good.
Yeah.
Very good. That's a good.
That we have to take. And girls who are in their puberty age, the menarche, they are also, now they face a lot of PCOS problem is most prevailing. Sir.
50. I work on this.
I see a lot of patients
PCOS.
here.
What do you give?
Mostly is the lifestyle.
Lifestyle.
Yeah.
Exactly.
Now girls are exposed to so many radiations and all. Their lifestyle, obesity is what I see. Even in the rural area, in the villages, I see a lot of obesity. I will tell
you the ICMR in-depth study which came yesterday. Obesity is almost same as in the towns. Absolutely rural areas. And the pre-diabetes.
Pre-diabetes.
It is also equal as in the town area. So you are absolutely prophetic that the rural area girls are also more prone to PCOS. That's a great concern. Pre-diabetes is a great concern.